If you're thinking about taking a GLP-1 medication, here are the two questions you need to ask yourself first. The first is, do the benefits outweigh the risks for you specifically? And number two is, are you ready, willing, and able to do the work to make the underlying lifestyle modifications to reduce those risks and to ensure that you sustain your results long term? I'm Dr. Rachel Felber. I am an emergency medicine physician and a women's health and strength coach. And in this video, I'm going to talk about GLP-1s, what they are, how they work, the pros, cons, and what you need to know before starting one. And to be clear from the outset, I am definitely not anti-GLP-1. I think they are a very valuable tool when used in the right patients the right way. Let's start with what are GLP-1s. So GLP stands for glucagon-like peptide, and this is a natural hormone that our bodies produce primarily in the gut in response to eating. And they help regulate appetite, blood sugar, insulin secretion, stomach emptying, and feelings of satiety or feeling full. The way these medications work is they mimic your natural GLP hormone. They look to your body very similar. So they connect to the receptor that your natural GLP hormones connect to. And they have a much stronger effect and a much longer lasting effect than your natural GLPs. When your natural GLP hormone takes effect, it's typically broken down within a few minutes or so, and the effect wears off. However, with these GLP-1 medications, they're not broken down the same way, and they last much, much longer, like several days or even a week. So some examples are the generic semaglutide, which is sold as Ozempic and Wegovy, and another one is tirzepatide, which is sold as Zepbound and Mounjaro. And the tirzepatide actually works on both the GLP-1 and the GIP receptors for, in most patients, an even greater weight loss and metabolic benefit. These medications have proven to be very effective for weight loss. What these medications provide goes far beyond weight loss. These medications can significantly improve patients' metabolic health. Some of the things that these medications affect include lower fasting glucose, lower A1C, better insulin resistance, improved lipid profile, better blood pressure, less visceral fat, which is the metabolically active, dangerous kind, lower inflammatory markers, improved fatty liver disease, and from the subjective experience of the patient, which is very important, is it tends to decrease the food noise. So this constant thinking about food and dealing with cravings. So for people who have been struggling with weight and metabolic disease and food noise, people with insulin resistance and obesity, diseases like PCOS, these medications can be really, really life-changing and an incredibly valuable tool that they can use to improve their metabolic health and overall health. So that's all the great stuff about GLP-1s, and they really can be great in the right context. The problem that a lot of people run into is that they see these medications as the solution, and it should not be seen that way. These medications should be seen as providing an opportunity for patients who struggle with these issues to have an easier time making the necessary lifestyle modifications so that they can build health from the inside out. If you take one of these medications without intentionally prioritizing things like strength training, eating enough protein, eating enough nutrients overall, sleep, hydration, stress management, all of the things that really everybody should be doing anyway. If you're taking the medication and you're not also doing these things, you are going to lose muscle. Now, the reason this is so problematic is that muscle is essential for a healthy metabolism, insulin sensitivity, immune health, cardiovascular health, bone density, joint health, cognitive health, and just overall the way that you're able to move and function throughout your life, and especially into older age. So the last thing we want to do is lose muscle, and that is inevitable if we take these medications and don't also do all of the important lifestyle modification. So what I see all too often is somebody will go on this medication and they will have a significantly suppressed appetite. Maybe they'll go in with the best intentions, planning to eat, 100 grams of protein a day and get their workouts in, but they have very little appetite. Maybe they're nauseous, maybe they're vomiting, they're really not consuming very many calories. It's not uncommon for people on these medications to consume less than 1,000 calories a day. So they're feeling nauseous and have very little energy, and it can make it very difficult to consume enough nutrients and have the energy to actually go and do a good strength session in the gym. And a lot of women see the scale changing, they're losing weight, and they feel like they're winning. This is what they went on the medication to do, to lose weight. And then that is objective evidence that that's happening. And they feel like this is fine, but they don't realize how much of the weight loss is muscle. And they might not even know how serious of an issue that is. Something else I hear pretty often is, I'm going to first focus on losing the weight. And then once my weight's down, then I'm going to shift my focus to putting on muscle. And the reason that is really a bad idea is that it's much easier to maintain muscle as you're losing fat than it is to put on muscle. You can lose many pounds of muscle in just a few weeks, but it takes a lot of hard work to put on many pounds of muscle. So I hope if you are thinking about going on one of these medications or you already are on one, I hope that you take away from this how essential it is to really put in the time and the effort to ensure that you're eating enough protein. You should really be tracking your food, at least track your protein to know that you're hitting your numbers, and getting in the gym or your garage or your living room and doing regular strength sessions. It doesn't have to be crazy. It doesn't have to be, for hours, many days a week. Really, the minimum is about 30 minutes or so twice a week. If you're new to strength training, that would be enough to help you hang on to your muscle while you're losing fat on this medication. Now, when these medications are taken appropriately, they are generally very safe, but they do typically come with some side effects that can be expected. Nausea, vomiting, diarrhea, constipation, bloating, reflux, all of those are not uncommon. There are much more dangerous, serious side effects that are less common, but certainly happen. This includes things like pancreatitis, gallbladder disease, bowel obstruction, which I've seen in the ER more than once, resulting in patients needing to have a colostomy because the obstruction is so bad. So that's the poop bag. And those examples were directly related to GLP-1 use. So it happens. Patients can experience severe dehydration, and you can get very sick from dehydration, electrolyte derangements, kidney failure. And this is another reason why it's so important to get the medications from a licensed professional who can evaluate you before you go on the med, who can be available if you have any questions or anything comes up while you're taking the medication, and can really have a good, thorough conversation with you about what to expect, what's normal, what's not normal, what you should go to the ER for. Ideally, your provider will talk to you about muscle loss, which is such an important potential side effect, and hopefully even help you arrange to have some kind of body composition testing done before you get started, like an in-body or a DEXA scan, something where you can measure your fat mass and your muscle mass before you get started. And every few months or so, typically every 3 months, can repeat that test so you can see objectively, am I losing muscle and how much? And do we need to do some kind of intervention to prevent further muscle loss or to decrease the rate of muscle loss while on the medication? So if you are thinking about taking a GLP-1, but you're not ready or you're not sure that it's right for you and you want to know what else you can do to get similar effects, to lose weight, to improve your metabolism, they are: start strength training regularly, at least twice a week, increase your daily movement, so walking more, especially after meals, improve your sleep quality and quantity, decreased your intake of processed food, eat more whole foods, and be sure that you are eating enough protein. Most women aren't eating anywhere near as much protein as they should be. Now, the truth is, many people who say they've tried everything to lose weight haven't actually done all of these things, all of these basics for long enough to allow their body to respond. Certainly, there are people who have tried everything and they've put in the work and they've done this stuff, and for whatever reason, it's not working for them. Of course, there are plenty of people like that, but there are more people who struggle with weight loss who have not mastered the basics yet. So that is the place to start. So the bottom line is these medications are an excellent tool. They should not be seen as the solution, but as one tool in the toolbox for the right patients who go about it the right way, the safe way, who are also making the lifestyle changes necessary to reduce the side effects, reduce the risks, and giving themselves the best chance of maintaining the result, especially if there's any hope of going off the medications in the future. The goal should not be to make your body as small as possible. The goal should be to make your body as healthy and strong and resilient as possible so that you can function your best, you look and feel your best as far into your future as possible. I'm Dr. Rachel Felber. Thanks for watching. And for more information on health, strength, and metabolism for women, hit subscribe.